Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest today is Joanne D'Adesio, and she's a patient with a very rare form of liver disease known as PBC. It's a progressive disease. She's here today to talk with us about this disease, her diagnosis, and what she's been doing living with this condition. Welcome to Health Professional Radio, Joanne.
Hi, thank you for having me.
Thanks for coming today. Now, give us a bit of background about yourself. You're a working mom?
I had been working. I recently retired, and I was originally a nurse and was a career changer into teaching. I'm a wife, a mom of 3 grown children, and, just a regular, ordinary person.
Now, as a nurse, when I know you changed careers and went into teaching. When you were in nursing, did you ever come across anything that even similar to what we're going to talk about here momentarily?
Never. Nothing similar. I was shocked.
No idea whatsoever. Now, what exactly is PBC? Okay,
PBC is currently called primary biliary cholangitis.
A mouthful.
And it's considered to be, it's considered to be an autoimmune disease that slowly destroys the small bile ducts in the liver. It causes inflammation, it leads to scarring, and eventually can lead to liver failure and the need for a liver transplant.
Now, you say you'd never heard of it. This is an extremely rare condition. Do you have any idea how many others like yourself suffer from this condition?
I really don't have a figure on how many, but it is considered a rare disease. And the people that it affects are usually between the ages of 35 to 60. And women are affected 10 times more than men.
Wow.
So both men and women can have it.
So both men and women can have it, but women, you say, by far outnumber those men living with this. I was looking through some stuff, and I when you talk about it being rare, maybe 1 in 900 or 1,000 women, that is extremely rare.
Yeah, because it's so rare, there's really not a lot of, information or talk about it. There's no celebrity, taking its cause. And the public and health professionals really aren't aware of this specific condition.
It's so rare, and with the public being relatively unaware, as well as health professionals themselves, how did you find yourself diagnosed with this rare condition?
Well, it started when I was in my mid-40s, and I just hadn't been feeling quite right. I was extremely tired. I was very forgetful, and I had some, joint pains. But, these symptoms are pretty vague, and you can really explain them away by being a busy working mom and, having a million things to do and people to take care of. And 20 years before, I'd been diagnosed with Hashimoto's hypothyroidism.
Okay.
So I thought maybe it could be due to my thyroid function. And eventually I decided to go and check with my primary doctor and see maybe my medication needed a little adjustment. But the thyroid levels came back perfectly normal. And I, questioned, what else could it be? This isn't normal. And she continued to do blood tests and called me and said, you need to come in. I need to talk to you, which is usually not a good thing. And we talked, and she told me that I have this rare disease. And at the time, the name of the disease was primary biliary cirrhosis. And when I heard the word cirrhosis, I was like, wait a minute. I don't drink. I've never taken drugs. I don't have any, high risk, behaviors that would cause, a liver disease with cirrhosis. That's all I heard was the cirrhosis. And the doctor educated me and said, it has nothing to do with alcohol. It has nothing to do with drugs. It is autoimmune. So you didn't do anything to cause it. And, we're going to have to, get treatment to see how we can best manage that. Mm-hmm. So, I really had to educate myself because, like I mentioned, I never heard of it. And, she gave me some information, and she referred me to a hepatologist or liver specialist. Mm-hmm. And he did more testing and confirmed that it was primary biliary cholangitis. And, he, kind of calmed me more and said, we can manage this. There is no cure for it, but with, the right treatment, there's a medication called ursodiol that can slow the progression. And many people, it's very individual how the disease progresses, but many people will never reach a liver transplant stage. So, don't panic about that. And let's just worry about, what we can do today to help you live daily with this.
So after some conversations with your primary and then a specialist and a little bit of educating yourself, you decided to treat yourself or to be treated with that drug that you mentioned?
That's correct. Okay. That's correct. That's really the only drug to start treatment for primary biliary cholangitis. And it, like I said, it'll slow the progression of the advancement of the disease, but it won't cure it.
You mentioned that when you first were diagnosed, you heard the word cirrhosis. Later, with the specialist, it had changed.
Well, it had been cirrhosis, and within the last year or so, because of the word cirrhosis and the stigma that's attached to it, they felt that as cirrhosis only occurs in the late stages of the disease, that they would change the name to primary biliary cholangitis. Cholangitis means inflammation of the bile ducts, which would be a more accurate name for the disease.
Well, you say there's nothing that you did. Is this something that is genetically based? Is
they
something
they feel that there may be some kind of familial component, but it wouldn't exactly be, genetic that you could pass it to someone. I'm trying to. They said that current studies indicate it may involve autoimmunity, an infection, a genetic predisposition. And sometimes, you may have a genetic predisposition and something triggers the immune system to respond and, activate the autoimmunity to the liver.
Did your adult children elect to have any testing done, or had they been experiencing any of the symptoms that they saw you go through in their young life?
Well, fortunately, my children are all healthy. And I asked my physician, is it the best thing to have everybody tested? And he said, no, it's not necessary unless there's some type of symptom that occurs that you want to, check.
I understand, the medication and monitoring by your doctor, but how much of a lifestyle change have you had to make based solely on your diagnosis as far as your diet, maybe exercising more or less? Has there been a drastic lifestyle change in addition to the monitoring and this medication?
Well, I've been trying to, follow the recommendations of my doctor, eating like a low sodium, low fat diet, have regular exercise, but not excessive. He suggested walking daily. And also, of course, no alcohol, and to maintain good hydration and get adequate sleep and avoid stress.
Stress
So that one's
seems
a hard
to
one.
exacerbate conditions. That's something that runs pretty much the gamut of anything.
That's correct.
I remember
correct.
you talking about your doctor calming you down with some more information, letting you know that, there was no need to panic. With that being said, what is the one thing that you'd like others to take away from today's interview about PBC in case they find themselves in your position, and where can we go online to learn more?
Okay. Well, I would really like others to know that they should be asking for a blood test to check your liver health during a regular physical exam. It's very simple, easy blood test, no big deal, and it really could give you a wealth of knowledge and allow you, should it be positive, to get early treatment. And, try and get support online. To get information, there's a great website called Living with PBC. So it's www.livingwithpbc.com. And it's great for patients, families, caregivers, anybody who's seeking information. It's a wonderful site.
Well, I sure thank you for coming in today and speaking with us.
I appreciate it, and thank you very much for having me.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Joanne Dedesio. She's a patient who's been diagnosed with PBC, a very rare form of liver condition. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud.